if, okay, looks like Facebook or YouTube's working. We're going to check on Facebook over here, see what it's doing. What's going on? I can't see myself. Okay, bear with me here, YouTube. We're going to pause you for a second. Hey, sorry on YouTube. We're trying to get Facebook up. Gonna do a live chat. Looks like Facebook's coming online too. All right, I think we're getting there. Just gonna refresh all the feeds and make sure everything's working. Okay, we're live. It's Facebook. It's Friday. Let me know if you're out there watching. Let me know if you can hear me and see me. It's acting a little bit weird, but I think everything's working. It's always hard to tell on this end of things to know for sure. So let me know if you've got me, if you can hear me and see me. I got a like. That's a good place to start. Okay, people are jumping on. I'm hoping you can see me. I don't know that my feed is refreshing, so I might not be seeing questions right now, guys. So I'm gonna try to refresh. Hey, okay, Shandy said hey. So thanks, Shandy. I think it means it's working. If anybody else is jumping on there that can hear me and see me, just put a comment in there that it's working. Sorry, it's always okay. Shaylee says can hear and see. Excellent. Okay, so I think everything's working. Um, YouTube's on, Facebook's on. All right, let's do this. Okay, so Facebook Friday. I'm here to answer your questions. So if you have things you wanted to get answers to, shoot me. Thanks, Erica, over here on YouTube. Shoot me a question if you want some answers. I'll talk to you briefly while people are getting on about exercise and pregnancy. That's a video that's going to come out on my YouTube channel probably later on this weekend. The gist of that talk is going to be that there are a lot of benefits to exercise in pregnancy. Hey, Bethany. A lot of benefits to exercise in pregnancy. One of the big ones is helping you maintain a healthy weight gain throughout the pregnancy, and there's evidence that that could reduce your risk of a C-section. So that's a big deal, and a good goal is about 30 minutes a day, 5 days a week, and 150 minutes is what that adds up to as a good basic goal. Now, if you're doing more than that already, keep doing it. It's not that you should not exceed that. That's just a good goal to. So, maybe like horseback riding after about 20 weeks might not be the best idea just because of the risk of fall and pregnancy, things like that. Sports where there's a high risk of contact, so, co-ed soccer is a pretty popular one, but there's a risk there, of course. The softball, maybe, where you might get beamed in the belly with a ball or with a body part from somebody else colliding into you. So those are the kind of things to think about. Hydrating and staying ventilated, not getting too overheated, avoiding things like hot yoga and hot Pilates. we don't want your core temperature to get into like the fever range. So those are the kind of things to think about. There will be a more detailed video coming up on my YouTube channel, like I was saying later on this week. I see a couple questions rolling in on Facebook, so I'm going to answer those. And you guys over here on YouTube, thanks for jumping in too. If you have questions, let me know. I'm trying to make sure. Let's get all messages. All right, Erica says she can hear me and see me. Thanks. Okay. Okay, so another Erica says, if I have spotting at 12 weeks postpartum, is that normal? Yeah, okay, so the short answer, Erica, on irregular bleeding after a baby is it depends. It depends on if you're nursing or not. It depends on what you're doing for birth control. Those would be the two big things, and probably also depends to some extent on what were your cycles like before you were pregnant, because that may give some idea of what kind of your normal is. But to say that sort of big picture, if you're nursing, then you may have no periods, you may have spotting. If you're on an IUD, you may still have some spotting. Birth control pills, even in the first couple of months after you start them, may be associated with some irregular bleeding. So in all those situations, it's probably still normal. The kind of things that would make me concerned, like, gee, this sounds like more than normal, heavy bleeding. So, if you're having like crazy heavy periods, that's not normal, and that might make you more concerned about some kind of complication, maybe like a little bit of retained placental tissue or something like that. So if it's heavy, I would definitely recommend get seen, probably need an ultrasound, see what's going on. If you're on one of the birth control pills that we talked, here we go, nursing and not on pills, haven't stopped. Yeah, okay, so it may just be an effect of nursing, Erica. But if it's heavy, then wouldn't be a bad idea to just get an exam, probably an ultrasound, make sure everything looks okay on the ultrasound. And assuming it does, then it's just normal. So yeah, okay, cool, thanks. All right, let's see, backing up just a minute here. Amy, do I need a recommendation to see the vein clinic downstairs? Spider veins. So no, you don't need a recommendation from me. You can just call Mindful Medical downstairs and schedule an appointment, and they'll be happy to see you. Okay, let's see. Heather had an endometrial ablation, and then had gastric bypass. Period came back with a revenge. Hope all's not lost. Yeah. Okay, so the basic concept here is return of bleeding after a previous endometrial ablation. And it happens. What I tell people at the beginning from the procedure is 80 to 85% of folks will develop light to no periods, and 10 or 15% of folks, it won't help at all. But in that 80 to 85 that are light to no periods, most of that data is like 5-year data. So within those 5 years, some people's periods do come back. Age is a risk factor. So the younger you are when you have an ablation, say in your 30s versus 40s or above, the higher the chance of failure, because you just have so many more opportunities to ovulate. And if there's any endometrial tissue that didn't die in that ablation, it can grow back over time. So it may be more to do with the time that has passed since the ablation and not so much to do with the gastric bypass. Although if you weren't having very frequent periods before the gastric bypass and before the ablation, then this may reflect just kind of normalization of some of the hormones that are sometimes out of whack if you're overweight. And then as you lose that weight and your hormones kind of go back to normal, your periods might resume. And then the unfortunate side effect is that if your ablation didn't work all the way, well, here's your period. So, but if it's heavy, if it's bad, then my advice, get an ultrasound, have an exam, see what's going on, and go from there. Okay, so let's see. Leah, hey Leah. Contraction have been fun. What do you suggest to keep them down? So it's hot outside. It's pretty easy to get dehydrated. So if you're feeling crampy, then one of the most important things to do is to stay well hydrated. Now, for people who are early in pregnancy, this is not likely to lead to a situation where we're concerned about preterm birth. So if you're first trimester, early second trimester, then that's not a real big concern. It's just mostly annoying. If you're late second trimester, third trimester, then of course the concern could be, well, is this going to put me in labor? It probably won't, but the contractions could be stronger. and even more annoying. So kind of same answer. Getting hydrated is probably the most important thing. Um, but in early pregnancy, not worried really, especially if there's no bleeding. Okay, Judy says, my thoughts on starting Cytotec at home for inducing. So far there's no data on outpatient cervical ripening, particularly with Cytotec. And Leah, 26 weeks. Yeah, just hydrate. If they get to like every 5 minutes for an hour, that's kind of a concern for labor, in which case it may be time to take a little visit labor and delivery. But if they're less than that, hydrate up. Okay, so back to Judy. Thoughts on starting Cytotec at home for inducing. As I was saying, there's really no data on outpatient cervical ripening, particularly with Cytotec. Cytotec's a pretty powerful medication, and in some people it can actually induce labor. So we have no information yet to say that that's safe, and therefore I wouldn't recommend it. There are some small studies looking at outpatient cervical ripening with Cervidil, which is a more expensive little tape placed vaginally, and that one is weaker and doesn't tend to cause as much concern for labor. That one's being studied for outpatient cervical ripening, as is the Foley bulb, but there's not tons of data yet. So my advice on Cytotec at home is, personally, I wouldn't recommend it. Okay, I saw a question pop up over here on YouTube, so let's see if I can get that to come up. All right, sorry, let's just see. Here we go. Okay, so Lori said, hey everybody. Questions are popping in now. Had a reversal after 7 years, have 8 centimeters and 7 on the right. I think that means tubal length. Always had heavy cycles that last 7 days. Is there anything to get pregnant fast? 4 kids now. I don't know that there's anything you can do to make yourself get pregnant fast, but there are some things you can do to kind of maximize your natural fertility. And there's actually a video on my YouTube channel under the preconception infertility playlist, or trying to conceive / infertility, I think is what it's called. And they have mostly to do with things like how you time intercourse, when you have intercourse, how frequently. In other words, daily leading up to ovulation is better than every other day, it turns out. There's some things with vaginal lubricants that are important to know, and a few other tips and tricks. So you might want to check out the video that's on the playlist. Like I was saying, it's under trying to conceive / infertility is the name of it. So maybe check that one out and see what you think, and good luck. Okay, let's see. Some other questions up here. Let's see. Erica says, hey, I'm 18 weeks pregnant, been getting cramps in the abdomen, something I should worry about. Was kind of, talking about that a minute ago. If it's just kind of mild, occasional crampy pain, no bleeding, then it's not something that's terribly worrisome. If the is severe, if you have bleeding, it's definitely worth getting checked out right away. And if it's not those things, then kind of hydration, especially in the summer months, is an important thing I've mentioned already a couple times. All right, cool. Let's see. So let's see. Live with May says, how soon should I start trying prenatal? So I recommend take prenatal vitamins whenever the thought enters your mind that you could either become pregnant or you're trying to get pregnant. And to me, that really just means if you're sexually active and you're not on like regular birth control, like an IUD or something. And even with IUDs, pregnancies happen, they're rare, but pregnancy could always occur. So anybody who's sexually active of childbearing age, who maybe hasn't been sterilized, it's not a bad idea to be on a prenatal or a multivitamin, just because preconception folic acid is what it's all about in terms of reducing the risk of spina bifida. So my advice, start it up if you're thinking about it. Okay, let's see. Amanda, 3 weeks pregnant. How will you know if you're having contractions? What will they feel like? Well, most people describe them as feeling kind of crampy, like menstrual cramps. And then when it's labor, they're a heck of a lot stronger than menstrual cramps, but that idea of that tightening or cramping sensation lasts about a minute, kind of builds up, hits a peak, and then eases off. The whole thing lasts about a minute. If you feel those coming and going like every 5 minutes for an hour, that starts to sound like labor. And in that situation, I'd recommend a labor delivery for a labor check. But if they're just infrequent, then that's normal. Some people have a few a day, that's okay, or maybe get kind of crampy after being active. And that's okay. So basically just watch out for the every 5 minute thing. If they get to every 5 minutes for an hour, it's worth getting checked out. And they last about a minute. Typically when it's the real deal, they're pretty strong. Some people describe them sort of taking their breath away. often just kind of stops you in your tracks and makes it hard to do much else during that minute while you're having that contraction. So those are the kind of things that I usually hear folks describe them like. So hopefully that helps. Okay, let's see. Paige, is it still safe to get chiropractic judgments for the party? So the big question is, is chiropractic stuff safe in pregnancy? Yeah, bottom line, I think it's fine for adjustments. There's evidence that mechanical adjustments for low back pain are helpful, and not necessarily in pregnancy per se, but there's evidence just in the general medical literature. So I think it's fine. There's no evidence of any risk in pregnancy for just simple chiropractic adjustments. So bottom line, I think it's fine. Okay, let's see. Londi said, son was recently diagnosed with Fragile X, so she's a known carrier. Would like to have more kids. Heard that anyone already has a higher risk of underly independence. Okay, sorry, this is a long note. Trying to read through it. I'll bring these up. Is there anything else related to this? So, the Fragile X thing, I don't know necessarily that age makes it any worse. It's a mutation of the X chromosome in women, and I think it's a generational thing. So as it's passed down from one generation to the next, that Fragile X area gets worse. And so there's these things called trinucleotide repeats, and there's increasing numbers of trinucleotide repeats with subsequent generations as you pass it along. And so that's what that's about. There is an association with early menopause. But exactly when it might kick in is hard to know. Probably, one of the better ways to get around it is if you want to use your own eggs, is maybe considering in vitro with pre-implantation genetics. So, presumably only one of your X chromosomes is affected. Otherwise, as a female, you'd be affected if you had both chromosomes. So that should indicate that one of your chromosomes is good. And so they should have DNA probes for that trinucleotide repeat. So you could do in vitro. You take the fertilized egg, the embryo, in the lab, and they can actually test it. And they should be able to sort out the ones that are affected from the ones that are not. And then basically you just put back the ones that are not affected, and you should be good. That's kind of the big picture. Now, I don't know all the specifics of your situation, but that's kind of the gist of it. So hopefully that's helpful. Let me know if you need more information than that. Okay, so Kylie, how much should a baby weigh at 4 months? Well, 4 months is like 16 weeks, so that's less than a pound. Exactly how much less than a pound, I couldn't tell off the top of my head. Probably, half a pound, somewhere in that neighborhood. So that's a vague answer, but put you in the ballpark. Okay, saw a question pop up over here on YouTube. Let's see. Let's just roll back. Okay, Rachel, we were supposed to be trying last week, had the smear test, it means pap smear. Carry on, don't worry about, unless you've had like cancer or something, then I wouldn't worry about waiting for your pap smear result. Okay, B and Sam, man, you're a fast swimmer, 1,700 to 3,000 yards in an hour. I wish I could swim that fast. Is it safe to continue swimming all 4 competitive strokes? Yeah, should be fine. It's low impact. I don't think there's anything specific to any one of the strokes that would really matter. So yeah, I think that's great. Keep doing it. I wish I could swim that fast. I'm like a 2 minutes per 100 yard kind of guy, pretty slow. I do like half Ironman stuff, and that's my worst event is the swim. So yeah, keep swimming. Maybe you could be my swim coach because I need to swim like you. Let's see. Okay, I think I'm all caught up. If anybody does not, if I haven't answered your question, if you don't mind, copy paste it. Maybe I didn't see it. I'm just gonna roll back through the YouTube stuff and see if I missed anything. But I think I'm pretty much caught up. Yeah, it looks like it. All right, cool. All right, well, this is somebody's great opportunity to ask a question. I got nothing else to say until I get another question. Yeah, I think I'm all caught up here on YouTube too. Awesome. All right, cool. Good. Oh, VBAC calculator got 71%. That's great. Basically I encourage people to try for a vaginal birth if you can get 60% or better. So 71 is fantastic. And would definitely recommend that trying to go for it for sure. Okay, Heather, can the IUD Let's see. Can the IUD cause bladder infections? Yes, there's no evidence that I'm aware of that the IUD itself is in any way linked to bladder infections. The main risk factor for bladder infections is actually sexual activity. So it's most common to get a UTI after intercourse. So, if that's a new thing, then that might be the risk. But if you were previously just as sexually active and just now happen to have an IUD, I don't think that that's really the issue. The IUD is way up high in the uterus. It's nowhere near the urethra. It's nowhere near the bladder. So I just can't imagine any physiological reason why the IUD would be linked with that. But if there are people out there who are having problems with UTIs, especially after intercourse, then a couple tips. One, pretty much everybody does, but just get up and pee after intercourse. That just kind of pushes the bacteria back out of the bladder, hopefully. There's some modest evidence for cranberry juice, like if you drink real cranberry juice, like an 8-ounce glass a day, you may increase or rather decrease your risk of bladder infections. And then some people who get frequent bladder infections, what we'll do, prescribe just a low dose antibiotic like a Macrobid, and just take one tablet after intercourse, and that will usually prevent the infection as well. So there's kind of some tips and tricks for folks who are having recurrent UTI symptoms. If you're going through all that and you're still not getting better, then my advice is see a urologist, see a bladder specialist, kidney specialist, because there's some studies they can do of your kidneys and bladders that may, give you a tip as to what's going on. All right, yep, Ashley, yep, a VBAC enthusiast for sure. So yeah, thanks for the encouraging words. All right, cool. P.S. Nice haircut. Thanks. I actually need a haircut. It's time, so I just kind of smoothed it down with hair gel today. All right, let's see. Judy, is there a limit about when you can get a Tdap? So no, we recommend Tdap. We try to get that going like 26, 28 weeks, mostly because we know it takes a couple of weeks for the antibody response to occur, and we're trying to get that antibody response in pregnant moms so that the antibodies they make cross the placenta and the baby gets protection. So if you're 38 weeks, if you got it today and you made it to 40, probably the baby's getting some benefit. If it's a week or so after the vaccine that you deliver, there may still be some benefit. So, I would do it. It's not going to hurt anything. It can only possibly help. And there's really no downside. I'd just go ahead and do it. Okay, let's see. So, Jerome, how are sebaceous cysts removed from the labia? I've had 3 on one side for over a year, another one. So, you remove it when your tubes are out. Curious how to take it out. Typically these are just like little local excisions. So, if you weren't having other surgery, it wouldn't be wrong to consider doing those just in the office under local. So you could numb it with a little numbing medicine and just kind of open the skin over that cyst, remove that cyst material, try to get as much of the cyst itself out of there, and then either leave it open to heal or you can sew it shut. Sort of depends on how big they are. The recovery of that is basically nothing. It's probably not much worse than if you just cut yourself shaving really bad. So I wouldn't think for sort of a normal size sebaceous cyst that I've seen that there's much of a significant recovery at all. So yeah, should be no big deal. Okay, I think I saw a question pop up over here. Let's see. Rachel, been very emotional and anxious. Something going wrong. Is this normal? Yeah. Am I being silly at 46 to expect a healthy baby? Well, no. I mean, hopefully everything's going to be okay. I don't, remember the whole story, but if you testing in the first trimester and it showed that there was no increased risk for any of the chromosomal stuff, and everything's been going okay, then odds are in your favor. Everything's going to be fine. So yeah, easy for me to say, but try not to stress. All right, I think I'm all caught up again. All right, well, you guys, I need more questions. Thanks for the ones you've given me so far. Thanks for watching. I see some maybe popping up. No, that was nothing. Okay, just gonna take a sip of water. You guys give me some questions so I can give you some answers. Okay, while I'm waiting around for people to throw some more questions up, let me know where you're watching from. I'm always curious to see how far this thing reaches. So over there on YouTube, where are you guys watching from? And how about Facebook? Let's see if anybody will tell me where they're watching from so we can get some idea of the reach of the Facebook and the YouTube. And at the moment, still just waiting on questions. So if you have a good question or you don't think it's not a good question, ask it because I got nothing else to talk about right now. Yeah, just waiting. So Ashley's coming in from Layton. Hello. That's like just across the way over there. Let's see. Judy, let's see. What are the percentage risk for whooping cough? What are the percentage of risk for whooping cough if I had it in a pregnancy 3 years ago? Had the vaccine in pregnancy. Okay. So I don't know the percentages, but the thing that the thing that is the question is what's the recommendation regarding pregnancy and the Tdap, and the recommendations that you get it every pregnancy. And the reason is that your immunity actually wanes pretty fast. So there's data out there that tracked the antibody response after a Tdap vaccine in healthy adults. And basically by 5 years, there were no circulating antibodies detectable in the majority of people that were studied. So the reasoning for why we recommend it every pregnancy is we know that when you first get the vaccine, you have a big jump in the antibody levels. They stay high for a few months and then start to decline. So, if it's 3 years out, yeah, I'm sure you still have some circulating antibodies, but in terms of maximizing the benefit of the baby, you're still better off getting the shot because you'll see those levels go way high again. And that's what we're trying to do is get your antibody levels up high so the baby benefits from you, because they don't get their first shots until about 2 months of age for whooping cough. So that birth to 2 months is the highest risk time. Okay, let's see. I missed one here. So Alyssa said, what factors can cause a high-risk pregnancy? Wow, that is a huge question. And so to just kind of like big picture, what are some of the risk factors? Well, obesity, being overweight is probably one of the biggest risk factors for almost everything bad. So when you talk about your risk of diabetes, hypertension, C-section, probably others that I'm blanking on right now, but the big ones, they are higher risk in moms who are overweight, and also in moms who gain excessive amounts of weight during pregnancy. So there's a video on my YouTube channel that it's called something like how to reduce your risk of a C-section, and the majority of that video is talking about not gaining too much weight when you're pregnant, because excessive weight gain is linked to C-section risk. So that's one. Age is another. 35 kind of historically is a risk factor in terms of risk for chromosomal abnormalities, other medical problems, and so let's mention epilepsy. Yeah, that's an interesting one. So there's a risk associated with certain anti-epileptic medications in terms of the risk for spinal cord defects like spina bifida. The interesting thing is it's not clear if it's definitively, if it's the medication or is it something to do with the epilepsy. So that one's not clear, but epilepsy is a risk factor one way or another for spina bifida. But aside from that, I don't think that it typically causes major problems. But other medical, pre-existing medical problems, diabetes, high blood pressure, lupus is a bad one if you're pregnant, although nowadays lupus is managed a lot better than it used to be. So that's maybe less of an issue, but definitely lupus, if you have kidney involvement or bad kidney function, that's a definite risky one. Pre-existing heart disease, if you have like a heart valve or something. So those are the kind of things that, big picture, that would come to mind for me. Let's see. Lisa says, what are the benefits and risks of drinking raspberry leaf tea during pregnancy? Bottom line, we don't know. We don't know because these type of dietary supplements and teas and things like that have not been formally studied. We have really no idea if they're a good thing or a bad thing. So not to sound short about it, but that's the honest answer. We just don't know. They're not well studied. I think things like that, herbal teas and whatnot, if they're in moderation, are probably minimal to no risk. And I also think that they are probably of minimal to no benefit. So don't really worry about them. But if someone was like drinking gallons of that stuff a day, who knows? We just don't know. So I would just say, things like that in moderation are probably fine, but probably no benefit either. Okay, so Kate, hey Kate, how you doing? If you have a question, hit me up because I need something to talk about. Let's see. Gonna check back over here on YouTube and see if I missed any questions. Yeah, here we go. Rachel, how much blood loss is normal in a miscarriage, and can it be life-threatening? Rarely would it be life-threatening. The kind of bleeding that I counsel people to watch for, in other words, to say, hey, if you get to this point, you probably ought to go seek medical attention, is if you're bleeding through a couple of pads, like big pads, an hour for more than a couple of hours, and it's not slowing down, it's worth getting checked out. Now, it doesn't mean it's life-threatening, but it could, if it continued on at that rate for a prolonged period of time, obviously you could lose enough blood for substantial anemia and for complications as a result of that. So couple big pads an hour for more than a couple of hours and not showing any signs of slowing down, that's when my advice is go to the emergency room and get checked out. So yeah, good question. Alrighty, I'm just gonna make sure I didn't miss anything here. I think I'm all good. All right, guys, I need more questions. I know you're out there watching. Hit me up. I got nothing to talk about right now. I got one person who said they're watching from Layton. Anybody else want to tell me where you're watching from? Just curious. Okay, let's see. Ashley, what are your thoughts on spinning babies? I think you probably mean like doing an external cephalic version. In other words, turning a baby that's not presenting head down. So baby was transverse at 30 weeks. That's okay. So I don't really worry about a improperly positioned fetus at 30 weeks because the majority of them will turn themselves around. You got plenty of time. So the other question I get a lot is, when do you start to be concerned about the position of the baby? So, 35, 36 weeks, I'm paying really close attention because you hope to see the majority of the babies by that time frame being head down. If you're still with a baby that's not head down by 36 weeks, then I'm generally planning on trying to turn the baby at 37 weeks. We like to do a term for a couple reasons. One is, just in case there's any drama, well, if we had to do an emergency C-section, then at least you were termed, so that's good. The other thing is you've given them plenty of time to hopefully turn before we have to do something about it. And if you do it too soon, there's a pretty high chance of them flipping right back. So although it's easier to turn a baby before then, it's also easier for them to just turn right back around. So I usually try to hit it about 37 weeks to get the baby turned. Okay, so Kate said, trying for baby number 3. I wish you lived in Utah. Well, I wish you would too. Come on back. I have a patient who's here now. They must be Air Force and are possibly moving away before the delivery, and they're moving somewhere, and they're worried about where they were going to be and that kind of stuff. So I just said, hey, come on back at the end of pregnancy. We'll just deliver you then. No big deal. Okay, cool. I think I got all the questions. What are your thoughts? I got all those. Shanda's in Clinton. Shout out to Clinton. All right, let's see over here on YouTube. We got Tulsa, Oklahoma. Wow. Okay, Erica, you're winning right now for the furthest distance. Now, last time I asked this question a couple weeks ago, I had somebody from Guam and I had somebody from England. So yeah, you don't get the furthest of all time, but Tulsa's pretty good, so that's all right. You were in right now. Tulsa's definitely further away than Clinton. All right, cool. Yeah, I think I'm all caught. I know, Didi, you're in Texas. Delaware, that's pretty good. That's across the country. I think Delaware's winning right now. That's pretty good. It's pretty amazing that you can just turn on your computer and talk to somebody across the country. It's nuts. That's awesome. Well, thanks for jumping on, guys. If you have questions, hit me up because I'm totally just filling time right now, hoping someone will ask me a question that I can answer. If you missed it earlier, I was talking about exercise in pregnancy, and basically it was a good thing. You were in Turkey last week. Holy cow. That definitely would have won. Yeah, that would have been a winner. Turkey, that's impressive. Yeah, that's up there. I think Guam's still further away. So I think Guam is all-time winner, but Turkey'd have to be top 2 or 3. But anyway, I was talking about exercise in pregnancy and all the benefits of it. Interestingly, one thing that I was reading from our college, from the American College of OB, that's like a patient information type paper. was saying that there's evidence that there are less, you get less back pain and pelvic girdle pain in moms who exercise regularly, which I found to be surprising and interesting. So it's kind of counterintuitive. If you're having tons of pain, you probably don't want to go do a bunch of exercise, but it may actually be helpful. So keep that in mind. All right. Rachel is on holiday in Turkey. That's awesome. How's Turkey? We've talked about going there, but just kind of worry about the security stuff. Let's see. B says any type of ab workout bad while pregnant. Basically abs are fine. There's nothing about the abs. The only concern with ab workouts is if you're doing them in the position we call supine, so laying on your back, particularly if you're after about 20 weeks. So the concern there is if you're flat on your back and you're over 20 weeks, then you may get some compression of the vena cava and reduce blood flow back around to the placenta and thus the baby. So that's really the only thing that you worry about in terms of abs per se. But if you're saying with the butterfly you use a lot of abs, that's fine. I don't think there's any harm in that. I can't do one butterfly stroke. So yeah, keep going. I'm probably gonna go swim after this with my wife. She's actually gotten roped into this Ironman stuff now too. She's actually planning on doing an Ironman in France. Kudase was beautiful, awesome, 36 degrees. That sounds hot. I don't know if that's in Fahrenheit, but it sounds hot. But anyway, my wife's doing this Ironman in France in August, so she's training up now too. Okay, let's see. Natalie, causes for extreme pelvic pain with your period. The big one everybody thinks about, of course, is endometriosis. Endometriosis definitely is one of the leading causes of painful periods. And that one's one that you can only really diagnose surgically, do a laparoscope and take a look and see in there what's going on. And in my experience, when I think somebody's telling a pretty good story for endo that I've taken to surgery, it's only about half the time I actually find it. So at least in terms of visible endometriosis lesions, about half the time you'll see them, half the time you won't. So I don't try to rush into surgery, obviously, because half the time you're not going to find anything. Try to manage it medically. One of the best ways to do that is to try to suppress your periods. So if your periods are painful, if we could get it where you're not having periods, hopefully you have less pain. So either like an IUD to suppress your periods, or birth control pills, just take them continuously so there's no breaks, no placebo times, and that should reduce your pain. Other things you can do, non-steroidals, ibuprofen, stuff like that. There's a prescription one called Ponstel we sometimes use. It's mefaminic acid. So those are some ideas to maybe consider. Other causes of pain, it sort of just depends on your history. If there's any previous past surgical history that might play a role. So those kind of things are things to consider. Okay, let's see. Chandra says, I do not usually exercise besides chasing kids. What is a safe way to start while pregnant? That's a great question. And that's actually, I'm going to talk about that some in the video that I'm going to do later this week. But the view of that is to just start gradually. Any kind of low impact, light aerobic type stuff is fine. So whether that's brisk walk, ellipticals, treadmills, exercise bikes are fine. I wouldn't recommend riding on a road bike or a mountain bike at 34 weeks because if you fall, that could be a problem. But if you're like first trimester pregnancy, probably not a big deal. So any kind of light activity like that's good. Swimming's great. Running's fine. If you just got to start off slow and work your way up. So those are the kind of things that I would think about. I hear my dog. If you guys can hear that, my dog's barking like crazy. I'm gonna go let him in. So hang on. Be right back. 1 second. I'm back. Okay. Barking dog situation has been addressed. Okay, let's see. 34 weeks pregnant, sharp pains around the belly button, really tender to touch. What do you think that might be? Could be like umbilical hernia. If you have like a little bulge there, that's probably a little hernia. It could be just some simple stretching out of the abdominal wall causing some pain. It's fairly common to have that kind of discomfort when you're pregnant. So in and of itself, not anything that sounds particularly concerning. As long as things like, the baby's moving good, no bleeding. Um, excuse me. So if you're having none of that stuff, that's probably all it is. Okay, let's see. Mama Mia Fitness. Yeah, I think, isn't she a labor and delivery nurse? I think she is. I think I know who that is. Actually, if you know, let me know. But I think she's an L&D nurse here. It's actually a really good nurse if I'm thinking the right person. Let's see, Paige. Let's see, blood and urine concerning. What can it mean? Yeah, it's a good question. The short answer is the most common is going to be maybe a urinary tract infection. So if you're having discomfort, burning, frequency of urination, stuff like that, then that's probably what it is. If there's no UTI symptoms, maybe a kidney stone, although usually those are associated with a lot of abdominal pain. If there's none of that and there really is actual blood in your urine, it's worth seeing a urologist that can look inside your bladder and make sure everything is normal in there. Because there are some things that can be on inside your bladder that could cause bleeding and should definitely be checked out. So I would start with just a good regular exam with your regular doctor, check your urine, see what's going on, rule out UTI, maybe think about kidney stones, and then beyond that, if it's still an issue, get checked out by a urologist. So let's see. Hey, Heather, let's see. 39 weeks. Sunday, pain, walking's almost unbearable. Just prolonging labor. Yeah, there's no evidence that not walking is prolonging labor starting, so don't worry about that. Fight through it and wait for labor to randomly start. Yeah, that's pretty much it. It is one of those deals. It'll start when it starts if you want to let it start on its own. Let's see. But it doesn't sound like anything bad. Okay, so let's see. Sydney just found out pregnant. Congrats. Went to Lagoon, ran all the rides. You'll be fine. The only real concern with pregnancy is like late second and then third trimester. So by that time, you've got this big placental mass in there. If you're spinning it around on a roller coaster or doing all kinds of crazy stuff, that could be an issue. But for the very first bit of pregnancy, the baby is pretty much bulletproof. So don't worry that you went to Lagoon and rode the rides. Everything will be fine. So don't stress about that. Let's see. Yeah, so we were just talking about that Mama Mia Fitness, yeah, or Mia Mama, Mia Mama, Mama Mia. I don't know which one it is. All right, cool. I think I got up. The dogs aren't barking anymore. Life is good. It's crazy hot here, so they're both just being lazy bums. I don't know if you can see them. They are right. There's one. There's the other one around the corner. Hard to do it on YouTube or on Facebook because it's such a delay. Okay, so yeah, I think we're all caught up. Oh, no, I'm not. Let's see. Rachel, finished pill on Friday. What can you expect with periods? Heavy or light? Will be using an ovulation test to find fertile days. It probably just has more to do with what were your periods like before. So if your periods were regular and not terribly heavy, then I would expect them to probably turn to that. So it's probably more about like what was your baseline prior to pills, because it should just go back to that. And if you haven't seen it yet, there's a video on my YouTube on the Trying to Conceive playlist that talks about how strategies to maximize your natural fertility. And one of the big things it talks about is ovulation monitoring. And it turns out cervical mucus actually is one of the more predictive, even more so than ovulation predictor kits. So maybe check that out. Plus, it's free. Don't have to pay for it. All right. Let's see, we've been going 42 minutes, 44 minutes on YouTube. So we'll probably go about another 10 minutes or so if questions keep rolling in, and I'll answer them until, 2:46 p.m. So we'll probably go to about just before 3 o'clock if we still get some questions rolling in to answer. Right now, I've kind of hit a lull. I know there's people out there watching. If you got a question, now is your time. Or if I didn't answer your question, if you think I didn't get what you were getting to, let me know. But I think I'm all caught up. Yep, looks like it. Well, here we go. All right, Rachel. Every 24 days, heavy and a nightmare. That's no fun. Yeah, I hope you get pregnant right away too, because that way you won't suffer from a bunch of pills, a bunch of periods. That is, yeah. Ariel, thanks. Hi, thanks for the nice words. Yeah, cool. All right. Well, hey, Ariel, or anybody else who's jumping on, if you have questions, this is a question and answer session. We're live, and I've already answered all the questions that are on the page. So if you have one, now is a great opportunity. I didn't hear you answer my question. Let me see what your question was, Erica. Let's roll back. Maybe it was a question about cramps in your stomach at 18 weeks. If that's the right one, let me know. Yeah, I mean, if there's no bleeding, then it's fairly common to have crampy pain. And so in and of itself, a thing to really be concerned about. So hopefully that was your question. Postpartum acne, is that common? Yeah, I mean, it can happen pregnancy wise, it can happen postpartum, really anytime. Of course, there's so many hormonal changes that are going on when you're pregnant that it's pretty much always a possibility. Um, I don't know that postpartum is any worse than pregnancy from a hormonal standpoint, but definitely possible. Let's see. Can you drink lemon balm tea during pregnancy? Well, I was kind of talking about that with somebody over here about red raspberry tea a minute ago, and the gist of it is there's just not good data to tell us if it's okay or not. So we think it's probably fine in moderate doses, but it just really hasn't been studied. At least in the U.S., the supplements and herbals and stuff are not regulated, so you can pretty much put whatever you want in there and say it's whatever it is, whether it is or not. So there's just a lot of uncertainty about what you're really getting, and then secondly, they're just not studied in pregnant people to really know. So I think the gist of it is in moderation, those kind of things are probably fine, but in higher doses, really just don't know. Let's see. Are there any supplements that you can be taking? Branched chain amino acids are fine. Catalyst, protein drinks are fine. I don't know what Catalyst is. Um, if you're talking about sort of amino acid thing, that's probably fine. Um, but yeah, I'm not aware of any particular supplement thing that will be a big issue. The main thing I like to be able to work, worry or be aware of is just the amount of caffeine that you're getting. So some of those pre-workout drinks have a ton of caffeine, like 100 milligrams per serving, that kind of thing, and that's a concern. So there's some studies now that are associated with increased risk for childhood obesity as you have higher intakes of caffeine, and it was not even all that much. Even like at 100 milligrams a day, there was a potential pretty substantial risk of childhood obesity. So if it's caffeine, I'd avoid it. If it's not, I wouldn't worry too much about it. Let's see. Try to prevent miscarriages. What can you do or take? Yeah, well, it's not wrong to say there's no evidence that progesterone has been definitively associated with any benefit in terms of reducing the risk of miscarriage because there's just no study that shows that it's of any benefit. So if your doctor is kind of which I sort of am too, sort of the therapeutic nihilist. In other words, if it's not been proven to work, I don't really routinely recommend it. I'll still prescribe progesterone to people because I don't think it's a big deal, but I do tell them that there's just no proof that it's particularly helpful. So let's see, got some questions pumping in on here on Facebook. Let's see, does the IUD cause weight gain? Um, get a lot of questions about IUDs and effects, and one of the more common concerns is weight gain. Um, if you look at the package insert for like say a Mirena, on the studies that they did to submit to the FDA for approval, there's this whole list of side effects, and one of them is always weight gain on pretty much everything out there, whether it's a birth control pill, IUD, Prozac, whatever. Weight gain is always a potential. It's usually something in a pretty small number of patients. It's usually in the single digit percents. I don't think that it's a big problem. I don't think that it's a common problem. But I think for an individual person, you never know. I mean, progesterone could cause some increased appetite, some fluid retention, so maybe a few pounds of weight gain. I wouldn't think that it would cause massive amounts of weight gain, just because we don't really know of any physiological reason why that would be. But a few pounds, it can. Let's see. Larissa, I'm going to be having a scheduled C-section any day, 39 to 40. Typically 39 to 40 for an elective repeat C-section is standard of care. So prior to that, there would typically need to be a medical indication, because if you look at NICU admission data, even at 37 or 38 weeks compared to 39, there's higher rates of respiratory distress in those babies, even at 38 compared to 39. So most hospitals nowadays won't let you do an elective repeat unless there's something else going on. Now, if there's a prior classical cesarean or some other medical reason, then that's a different story. But just straight up, nothing's wrong, just elective repeat, that's 39 to 40 weeks. Okay. Is lunch meat still a big no during pregnancy? Yeah, I mean, uncooked, cold lunch meat I would avoid. There is concern for listeria infection, and it can cause pregnancy loss. So if you have some deli meat that was improperly handled in the process plant, wherever it was put into a package, and then you take it home and eat it, if it's not been reheated to like steamy hot, then there's a chance that if it's contaminated, you can get that infection. It's a foodborne illness, and it can cause pregnancy loss. So I tell people it's okay to have deli meat, but you need to have it steamy hot. And I don't recommend using the microwave, because you know how that goes with microwaves. Sometimes one area gets really hot and one area is not. So you might not potentially kill all the bacteria. I'd put it like on a griddle or a panini thing or whatever, so that you know that it's thoroughly heated, because it's devastating if it happens. We had a listeria outbreak not terribly long ago, maybe a year or so ago, not from deli meat, but from some sort of prepackaged smoothie stuff from Costco. And then back when I was a resident, we had a really bad listeria outbreak in my community. It was associated with people using unpasteurized dairy, and there were many, many babies that died. It was tragic. And so that's the kind of thing, like it doesn't happen very often, but if it happens, it's devastating, so you don't want to take a risk. So that's my advice on meat. Okay, let's see. Is there any danger or risk of baby coming early if you have sex? So, if you're talking about a situation where uncomplicated, no incompetent cervix, no cerclage, no placenta previa, no heavy vaginal bleeding, no chronic abruption, none of those kind of risk factors, sex and pregnancy is fine. But if you have any of those other risk factors, then a lot of times we do recommend pelvic rest, which means no sex. But if you don't have any of those risk factors, it's fine, and I wouldn't worry about it at all. Okay, let's see. What are your thoughts on vinegar douche for female sperm and follicle? No, there's a video, you should totally go watch it if you haven't already, on my channel. It's called How to Have a Girl or something like that. I think it's hilarious. But that's all about like the Shettles method and the pH stuff, and there's just no proof. It's been thrown around for years, but there's just no proof. So about the only way you can guarantee a girl is do in vitro and do pre-implantation genetics and test the sex chromosomes, and then you'll know. You can do cell sorting. A couple fertility centers in the country where they try to, because X-bearing chromosome are of different size than Y-bearing chromosome sperm, but even that's not perfect, somewhere up in the 85-90%. So even that's not a guarantee. IVF's about the only thing that you can really do, but the vinegar thing is like 50-50. So, but check out the video. I think it's funny. I enjoyed making that one. Let's see. Brandy, is there a magic diet pill? No. I love easy questions. No, there's not a magic diet pill. There are pills out there that are approved for weight loss for people who are overweight, particularly in the obese, morbidly obese. They all have risks. Most of them are fairly expensive. The one that I've prescribed the most is Belviq. It's not a stimulant. This is not a commercial for Belviq. I'm not getting a dime from them. But I think that of the weight loss meds, it's probably the one that's the safest, because it's non-addictive, it's not a stimulant. It doesn't have anything in it like anti-seizure meds that can cause birth defects if you happen to get pregnant while you're taking it. It works within the brain in the satiety center, which is the part of your brain that controls hunger and the sensation of being full. It's not cheap, which is why you don't hear a lot of people talking about it. I think it's at least 75 or $100 typically with commercial insurance around this area. $100 per month, that is. So it boils down to what, about $3 a pill. But I've seen some pretty decent results with it. Although nothing beats, the obvious stuff, which you already know, put in the work. Diet and exercise over the long term are the most effective methods. So that's where I really recommend you go. Okay, let's see. Is it true that if the cervical mucus is acidic, it hinders conception? Not aware of that. I'm not aware of anything regarding the pH of cervical mucus regarding fertility ability. There's some data out there that certain types of lubricants can affect sperm motility, though. So there's a couple that are like Pre-Seed. Again, it's not a Pre-Seed commercial. That's just a name brand that pops in my head. That do not impair sperm fertility, but like KY, Astroglide, those lubricants do. So I don't recommend those if you're trying to get pregnant. A lot of the sort of natural oils out there. So I'm trying to think of a vegetable oil. It's in my video on maximizing your natural fertility. There's maybe it's canola oil, I think it was. There's 2 or 3 of these kind of like natural plant oils that are equally effective as the expensive Pre-Seed and are dirt cheap and don't affect sperm motility. So that's about it. But I don't know of anything that's specific to pH. So I wouldn't stress about that. All right. So holy cow, I've been going 55 minutes on this stream. That's crazy. If you have questions, we're going to wrap this up in about the next 5 minutes. So if you're dying to ask your question, now's your chance. I'm just looking back through the YouTube comments to see if I missed anything. I don't think I did. I think we're caught up there. And I'm pretty sure I'm caught up on the Facebook as well. Cool. Okay, we'll give this another couple minutes. And if anybody else has a question, hit me up. Is it bad to have a can of Dr. Pepper a day while pregnant? If that's your only source of caffeine, 1 per day is fine. So about 50 milligrams of caffeine is where a typical serving of either coffee or soda is, if we're talking about normal size servings. And there's not tons of evidence that that kind of low dose is bad. Although I will say that this most recent study on caffeine and childhood obesity, they did show a transient association between caffeine intake, even at that 50 milligrams per day, and childhood obesity at earlier stages in life, like maybe 2-3 years. So in tea, same thing. It just sort of depends on if it's decaf or not. But generally speaking, probably 50 milligrams a day is not a big deal, but there may still be some residual risk of childhood obesity, even at that level of exposure. So I just use caution. Check out the video if you haven't seen already. Let's see, what's your opinion on the Subutex? Actually there's a video on my channel. It's at the absolute bottom of my list. If you go chronologically and go to the oldest videos, you'll find it like first or second video I ever made. So I actually have a fair amount of experience with Subutex, Suboxone in pregnancy. I'm actually a waivered prescriber here in Utah, and so I've had many patients, unfortunately, who were in a situation of opioid addiction and abuse when they got pregnant, and I've helped a lot of them to get converted over to Suboxone, Subutex, and about half of them successfully tapered off before delivery, and the other half stayed on it because it was too late or the doses were too high to get tapered off before they delivered. The main concern after delivery is for what's called neonatal abstinence syndrome. So if you've been taking this the whole time and then you deliver, the baby's going to go into withdrawals. It's a guarantee. And anybody who tells you otherwise is kidding themselves. I've not had a single patient who was taking it long term who didn't taper off, who then delivered, who the baby didn't have neonatal abstinence and go to the NICU. So it's a guarantee they will. But if that's your option versus heroin use, it's a no-brainer, right? Because at least Subutex is not going to give you HIV or hepatitis or get you killed because of all the illicit stuff that goes along with trying to obtain heroin on the streets. So I think if those are your two choices, go for Subutex. If you're a long-term user of Subutex that gets pregnant, I would advise that person to try to taper off before they deliver. Try to reduce the risk of neonatal abstinence, but sometimes it's just not possible, and that's okay. So yeah, I've had pretty good experience with it and have not seen any major long-term problems. It's just that whole neonatal abstinence thing that's the concern. So it's a good question. Let's see. If you take inositol and folic acid together, does it prevent spina bifida, high risk of baby? Yeah, the methylfolate, Didi's right. If you're high risk, methylfolate's where it's at. So like Nevo DHA is a prenatal vitamin here in the U.S. that is methylfolate. You can get methylfolate by itself. The methylated is it just in case you happen to be one of the people with the MTHFR mutation. It gets around that step in the metabolism and therefore helps reduce that person's risk of spina bifida. So if you don't have MTHFR, it's probably not such a big deal, but it's certainly not wrong to still take it. So he's always on it, man. She is always on it. Cool. Let's see. I think I'm caught up. Okay, we're gonna give us like another minute or two. Looks like Facebook has kind of dried up. I haven't seen any questions in a minute. There's still people watching though. Hi, all 13 people. Let's just make that be quiet, because you know it's nobody. Who calls a home phone anymore? So yeah, we'll give us another minute or so and wrap it up. You know, as always, these Fridays, I do these usually most every Friday afternoon. I miss one every now and then. Usually about 2 o'clock p.m. Mountain Standard Time, wherever that is for you guys. That's the time I'm usually on here on Fridays doing this Facebook Live. So keep that in mind. If you haven't already, you can put the notification bell on YouTube. I think there's something similar on Facebook so that you can be notified when I do these live things and you can jump on and get your questions answered. So keep that in mind as well. Let's see. How much folate's recommended? Well, if you're just an average risk person, no prior history of spina bifida, then 400 micrograms is the minimum recommended dose. A milligram is 1,000 micrograms is what you see in most prescription prenatal vitamins. So 1,000 milligrams, 1,000 micrograms, 1 milligram is great. If you have a personal history of a baby being affected with spina bifida, it's 4 times that, so it's 4 milligrams of folic acid. Okay, Jordan. OB says there's no accurate way to test the hormone levels. Yeah, I mean, in the big picture, that is true because hormone levels vary throughout the day. So if you check somebody morning, noon, and night, you'll get 3 different levels on basically all people. So it is difficult to know what to make of that. There are people who try to do these 3 times a day salivary levels and try to make some sense of them. And I find that equally difficult to interpret. So I do agree with that big picture. It's really hard to know what those numbers mean, except in extreme situations. I mean, if you have somebody who has like no detectable hormones, that's pretty obviously a problem. If you have somebody who has crazy high levels, that probably means something too. But pretty much everything else in the middle is just a crapshoot. So yeah, I don't spend a lot of time checking hormone levels. The only exception is for infertility. When you have a patient who's on stimulation either for IVF or for just an injectable cycle, it is important to monitor estradiol levels because that does give you some feedback on what's going on at the follicular recruitment level as you're trying to get the right amount of stimulation, not too much. Those estradiol levels are helpful, but pretty much there's not any other routine situation where they're of any use. If you have somebody you think is menopausal, then checking like an FSH level can be helpful, but most of the time you can sort that out just based on their symptoms. So yeah, good question though. Okay, we'll give it another 30 seconds or so. I don't think anything else is popping up. I think we got everything covered. So yeah, so once again, thanks everybody. I totally enjoy doing these things. I really appreciate you jumping on here and spending your time and asking your questions. I say this every time. If you didn't ask questions, I wouldn't have anything to say. I'd just be sitting here spinning my wheels. So thank you for jumping on. Thank you for your questions. I'll look for you again next time, probably next Friday, about the same time. All right, guys, I think I'm going to leave it there. If I didn't get to your question, you can leave it in the comments below and go from there. All right, thanks, everyone. Take care.